XMed, a company with a 10-year experience in the medical field, presents Traqueotac, an innovative kit for percutaneous tracheotomy. The kit is composed of a tracheostomic cannula with a pierced spindle, a needle with catheter for the Seldinger insertion, a graduated Seldinger with tally marks every 10 cm, a dilator, a 20 ml syringe, a scalpel blade, a tracheostomy cotton tube holder, and a disposable dilating forceps, the Traqueoforceps, the real strength of the kit. Traqueoforceps is a disposable patented product. It permits the union and the improvement of the Greek forceps and the Chiaia dilator. Traqueoforceps optimizes those technical and functional aspects neglected by the Greek forceps. It is possible to identify the main innovations in 3 points. The arms of the forceps open through a compression instead of a traction, so that it can be used with one hand. It is possible to decide the width of the stoma thanks to a control switch placed on one arm. The absence of the switch on the usual forceps often causes undesired lacerations. The guide wire stays inserted inside one arm and guarantees the freed maneuvering of the forceps. On the contrary, the traditional Greek method implies the loss of the guide wire every time the arms of the forceps open. Another important characteristic of tracheoforceps is its very structure. The points of the arms in particular mirror the shape of the Chiaia dilator. The symmetrical opening of this dilator permits the accomplishment of stomas with no compression of the tracheal forewall, which could be damaged by excessive strength exercised during the opening of stomas with traditional dilators. Let's examine now a clinical case. 68-year-old man, sedated and intubated with a laryngeal mask. It is necessary at first the positioning of the patient so as to obtain the extension of the neck. Then we locate the spot where the stoma will be incised. It is usually between the first and the second, or between the second and the third tracheal ring. A vertical incision of about 1.5 cm or 2 cm is made on the selected spot. It is enough for the subsequent passage of the tracheostomy cannula. It is possible to make a first loosening of the subcutaneous tissues with the help of a small claymore. Hook the needle with the catheter and the syringe filled with a small amount of physiological solution. Insert the needle perpendicularly to the tracheal axis. The introduction of the needle inside the trachea is confirmed by the presence of air in the physiological solution. Once the trachea is reached, remove the needle and leave the cannula inside. It will guide the insertion of the Seldinger. The guide wire will be put in a caudal position. Remove the cannula, then insert the dilator, making sure to let it slide on the guide wire through the soft tissues to the tracheal wall. With a rotatory motion, insert the dilator inside the trachea till the largest diameter of expansion. Leave it there for about 30 seconds. Before the insertion of the forceps, regulate the safety pin in the desired position. Remove the dilator and insert the Seldinger into the right arm of the forceps. Insert the forceps in closing position inside the trachea, always keeping the arms perpendicularly. Verify that the points are inside the trachea with the help of the endoscopic view. Now start dilating with small and repeated openings, so as to advance constantly and gradually. The arm's shape so devised, very similar to a dilator cone, permits a dilatation of the tissues with no laceration. Thanks to the symmetrical opening of the arms, there is no compression of the tracheal walls. The celdenture inserted in the arm permits the repetition of some stages of the operation with no risks. Once the stoma is incised, the forceps is removed while the cannula is inserted, making it slide on the celdenture till its definitive positioning. Aspirate the interior of the cannula and check the right positioning through endoscopic view. Expand the cap and stick the tube holder, given any possible medicament.